Good afternoon. My name is Joe Doherty. I'm the Communications Director for the Utah Department of Public Safety and the COVID-19 response for the state of Utah. Today is the weekly briefing for Thursday, September 17th, 2020, and it's my pleasure to introduce Dr. Angela Dunn, the State Epidemiologist for the Utah Department of Health, and she will be followed by Governor Gary Herbert. Dr. Dunn.
Good afternoon. Our 7-day rolling average is 661 new cases. This is an increase from last week when we were at 381 cases. Our percent positivity has also increased. We are now at 11.9%, whereas last week we were only at 9.1%. This is the highest percent positivity we have reported during this outbreak here in Utah, and the second highest 7-day rolling average of new cases. And today, we're reporting 911 new cases of COVID-19 identified in Utah, our highest single-day case count for new cases. What makes this so alarming is that we have gotten to this peak of a 7-day rolling average of 661 new cases in 1 week. During the summer, it took us 6 weeks to reach this level. But what we've learned from the summer peak, which was started in the young and the healthy, is that COVID-19 then spread to more vulnerable populations, and it led to a peak in hospitalizations and deaths. The initial part of this current surge was driven by 15 to 24-year-olds, but in the recent days, we have seen an increase across all of our ages. So we need to take immediate action to prevent unnecessary illnesses and deaths in the state. I'm especially concerned with what we are seeing in Utah County. They have been experiencing a surge for the past 3 weeks, with the greatest increase in the past week. 40% of our new cases in this past week are from Utah County, but they only account for about 20% of our state's population. And there's parts of Utah County that have infection rates of 1,400 cases per 100,000 people. This is approximately 6 times greater than the state's infection rate. And we are on pace to match or exceed infection rates that we have seen in the Navajo Nation and in New York City. We are going to continue to do our job as public health with increased access to testing, contact tracing, and providing you with timely and honest data. Other tools include, of course, wearing a face covering when you're out in public, practicing physical distancing, staying home when you're sick, following quarantine and isolation guidance that public health gives you, and getting tested if you have any symptoms at all or if you're a close contact to a confirmed case. We are all part of the solution here and need to do our part. Thank you.
Well, thank you, Dr. Dunn. As always, we appreciate your work and your dedication as we fight this pandemic. We've had some good news days, mostly good news, as we've had reports each and every week. Since March, we've had the ups and downs, but certainly the trends have been favorable as we've accomplished a lot of good things, as evidenced by the fact we still have very low mortality rates in our state, lowest in the nation, and our economy is still, in fact, performing well. Unemployment rate at 4.5%. We'll have new numbers coming out tomorrow, but I'm sure that they'll stay as equally good, if not better. So on balance, we've had some good news of how we've handled this pandemic heretofore. Today is not one of those good news days, though. Today we have a significant and troubling concern with this tremendous spike we've had this past week with our case numbers, culminating with 911 today, and should cause all of us concern, the highest single count we've had since the beginning of the pandemic. So we are concerned. I'm concerned. I've called, in fact, just came out of an emergency meeting with our unified command and talking to the stakeholders. I've had conversations with the Speaker of the House and the President of the Senate. We're all concerned of what's taking place and wanting to know why. And then, of course, the follow-up question is, what should we do about it? We look at the spike in numbers, and again, some of this was not surprising in the fact we have a spike. It is a little surprising in the magnitude of the spike and how many the numbers have accelerated so greatly. But going back to school is certainly an activity that as we have more social interaction, it would not be surprising to us to see more people become infected as people have interaction with each other, and that coronavirus has the ability to spread. So it's not surprising, but it is, we're finding that in fact, the age group that's spiking the fastest right now is the 15 to 24-year-olds. That really means our high school students and our college and university students are at the center of this spike that's taking place, which I think this younger population really is acting as kind of the canary in the coal mine. It is a red flag warning for all of us that, hey, things are happening out there. This is a dynamic situation. Again, as we've said, this is a unique pandemic. We have not got any blueprints of how to handle it or what's the cause and how to treat the coronavirus. We hope that a vaccine's on its way. I believe that in fact will be the case. And the question is, what do we do and how do we do it until that event occurs by the end of the year or the first part of, maybe the end of the first quarter of 2021. That's what our local medical advisors think will be the timeline. That being said, again, as we see these growth of spikes, and particularly in the 25 to 44-year-old overall, and now the 45 to 64-year-old. So the age group is moving down that are contracting the virus, and not just the elderly in our population. In this emergency meeting that we had with our unified command here just completed, and the leadership and the stakeholders involved in this attempt to stem the tide and slow the spread of the coronavirus. And that, by the way, this will continue. I'm going to meet through the weekend with others as we decide, and analyze the data and what does it mean. We don't want to overreact, but we certainly don't want to underreact. And my concern is that all of us need to understand what the data means and what our individual roles are, respectively, that we should be doing. What are the actions we should be taking as a community at large? Let me just tell you, I've written down here some things that I'm alarmed about. I'm alarmed that our case counts are growing when they should be stabilizing and dropping. I'm alarmed by what that means to us. Why is it happening? And the higher case counts will lead to more hospitalizations and deaths. As you heard Dr. Dunn talk about, if we have more cases, then we're going to end up having more hospitalizations and more deaths. There may be some mitigating factors if the younger people are getting more of the cases as opposed to older people, which may have the senior citizens may have a more visceral reaction to the coronavirus and more susceptible to in fact, mortality under this pandemic than our younger population. But nevertheless, this is a lagging indicator. Our hospitalization rates have stayed pretty constant, but the worry now is what's going to happen in the next 2 or 3 weeks as this lag time is in place, and we may have, and we hope we don't, but we may have increasing hospitalization rates and death. That causes me some alarm. I'm alarmed by people who ignore health guidelines and those who are out there promoting social gatherings almost in defiant of the recommendations by our best minds in science and medicine that say, social distancing is an important aspect of how we slow the spread and how we maintain, our economy to stay open. Our medical advice and the direction we get from science and data would indicate to us there are certain protocols we should follow. We all know them. We can probably all recite, wear a mask, social distancing, good hygiene, wash your hands, don't go to work when you're sick. Mostly all common sense things, but we have people who are just ignoring them almost defiantly. I'm alarmed because people seem to indicate they don't believe in the science. And I know that there's things you can find, and probably everything we have is not perfect, and we're learning as we go. That shouldn't alarm us at all. In fact, we should welcome that as we learn more things. But just because you find it on YouTube or the internet doesn't mean it's correct. I trust the local medical advice that we get here from really smart people. I appreciate the BYU and their science research on 120 different studies on the benefit of wearing masks and face coverings. And as we've said, this is really about how can we, in fact, protect others besides yourself. And so I'm alarmed about what I consider a lack of concern some Utahns have for the welfare and the well-being of others. It's not just about me, it's about all of us together. I wear the mask to protect you. You wear the mask to protect me. That's how this virus works, and that's how we ought to practice our association one with another and show the concern we have for our neighbors. We're calling upon, at this time, our local elected officials to take a look and analyze where you're at with the data in your respective areas of responsibility. County commissioners in Utah County, for example, mayors in Utah County of the cities, and not just Utah County, but the other 29 counties in their respective areas. Some are doing much better than others. But again, the responsibility of directing policy in your backyard falls upon those local elected officials. And so we want them to lead, look at the data, and give recommendations as far as what should happen to make sure we stay on top of this pandemic and stem the tide of the growth of these infections. Secondly, we're calling upon the local health departments. We have 13 of them throughout the regions of the state. And we want them to, in fact, to do what they do best, which is use the science and the medical advice to give us recommendations to the elected officials of what should be good policy. And they should be leading out on this, not being subjected to political pressure to modify their research and their understanding of the healthcare risks and the data out there and what is taking place with the pandemic. They should lead out and make sure that they're giving the best recommendations they can based on the best science and the best research that's being done. And so we hope that health departments will step up and make sure that that's in fact what's happening. I think it has in most instances, but not in every instance. They should not bend to political pressure. Last but not least, at the end of the day, no matter how good our plans are, if we don't in fact modify our behavior as citizens of this great state and do our part as citizens in our communities, it won't make any difference. The pandemic will just run wild, whatever that means, whatever it will entail, whatever the end result will be, as opposed to us trying to control our own destiny as best we can. So we call upon all of our citizens of this great state to modify your behavior, do the right things, care about your neighbor, and follow the protocols that have been outlined for so long that we all know actually do work in slowing the spread of the coronavirus. Let me just suggest here as I kind of wind up that one, this battle is not going to be over anytime soon. We can modify the outcomes and improve the situations, which we've done over time. We're in a much better position today than we were back in March when we had more restrictions put in place. We've learned about this, we've modified, we've evolved, we've improved. I expect that to continue. This is just a part of a stretch of the road that's a little bumpy. But until we have a vaccine and we can inoculate ourselves against this, which is down the road sometime, it's not a matter of if, it's only a matter of when, we need to find ways to see how we can, in essence, tread water. How can we, in fact, tolerate? How can we make sure we protect the vulnerable among us in particular, but all of us in generally, to make sure we don't have health problems and health concerns and the long-term ramifications of this COVID-19, we don't really know. And yet still make sure that our economy continues to function, that we don't have a problems of having no job and no economic opportunity out there for the people of Utah. We need to continue to recognize this as a balancing act, finding the appropriate balance between health care protecting the lives, as we say, of people and their livelihoods. We need to make sure that we understand that is the goal and that's the quest until we get a vaccine. And we need to remember that we have a role to play, all of us. And whether that's a little or a lot, if we all play our part, we're going to end up getting a better outcome. Again, it's been mentioned, I have a lot of concerns. I'm very concerned about my home county of Utah County, which is having a significant, serious spike in infections, or a significant disproportion, where we have less than 20% of the population, yet we're having up to 40 to 45% of the infections coming out of one area. That should cause us all concerns. There are other areas like Sandy and Draper and Harriman here in Salt Lake County that also are having spikes. Some of our urban areas seem to be the most volatile right now, which we need to ask ourselves why, and then what should we do about it. We have several pending requests from counties across the state to change their color designation. In light of today's numbers, we are going to postpone making any announcements on color changing, and are going to suspend that announcement until sometime next week. And we'll, in fact, review the numbers and make sure that we're not doing something that's incorrect or premature, or something we'd have to roll back shortly after maybe improve it to a green color and have to move it back to yellow in a week. So we're going to be a little extra cautious in that regard in light of these new numbers. We'll be meeting here over the next days with stakeholders and our best minds in science and medicine to determine a plan of action going forward. We're not going to sit back and be like the ostrich, head in the sand. We do recognize this is a red flag warning. We're going to analyze the data in some detail, work with the local stakeholders throughout the state where we see some significant problems, and together come up with the plans of how we're going to go forward. For example, we are going to increase our opportunities to have testing. We see our testing numbers have dropped down. It's a little bit puzzling as far as to why, but we're going to open up testing to anybody who wants to be tested without having to have symptoms. We'll be working with the legislature to make sure that this is able to be funded. We would like not to have the cost of a test to inhibit anybody's ability to go get tested. And so we'll be having an announcement on that here in the next couple of days as far as how that will take place, along with other measures that we plan to take, which could include stronger government intervention, stronger government measures as we go forward here, because we are taking this spike and the magnitude of it very seriously. We are going to ask all of us again to do our part. Again, all of us have, I think, the opportunity to do some. And so if you've been doing your part, thank you. Most people have tried. And if you've been doing your part, please continue. Encourage others along the way to join with you. If you haven't been doing your part, now's the time to start. Again, we know wearing masks is inconvenient. We know wearing a mask is not fun to do. But it's a little bit of sacrifice, a little bit of inconvenience that will help us for the overall goal of stemming the tide of the growth of this pandemic and this coronavirus in our communities. It will allow us to have the economy to continue to flourish. It'll help us get to the finish line of this quicker and better than if we don't. So again, we know there's sacrifice involved. We know there's inconvenience. But please do it in behalf of not only just yourself and your loved ones that are around you, but for all the people outside. Again, I'm going to wear the mask to protect you. You wear the mask to protect me. With that as a kind of our backdrop, again, I'm looking forward to us working together. I believe we'll have a successful outcome. It's going to take us some time to get to that point, but we've got time on our hands and we're doing well, all things considered, on a balanced approach. But we understand now, here's a red flag warning. We need to redouble our efforts and do even better if we're going to finish this year in a good shape. So we start 2021 and really a good opportunity for schooling, for economy being opened up, and to make sure that only a minimum of our citizens are sick with the COVID-19. So thanks for all you're doing and all you're going to continue to do. Now we'll see if there's any questions you have for us at this time.
Yes, this is Wendy Leonard with Deseret News. Governor, what exactly are you asking of local officials and health departments to do? Are you hoping more of them will enact mask mandates?
That's certainly on the table. We'll have those discussions. I think mask mandates, we've always said we prefer that to come from the local government officials elected by those in that community. They're in touch. I've not been a one-size-fits-all approach. We've given everybody opportunities to analyze that and to make decisions and to lead. We'll take a look at that over the next few days and see if they're doing enough and if the state needs to intervene or the local health department or the state health department on more aggressive approaches. We'll wait and see what happens.
Yes, this is Jacob Klopfenstein with KSL.com. Governor, I know you mentioned you just came out of a meeting with the Unified Command, and it sounds like you mentioned some of the things that were talked about in that meeting. Can you be any more specific about what the state leadership is looking to change right now, either from that meeting or from other areas that have been talked about?
Well, we want to make sure that people's behavior is modified in an appropriate way to help slow the spread of the coronavirus. And that means we have to do things either voluntarily or because government mandate. We prefer to make sure that that's done, if there's any mandate, it's done by the local government people who step up and say, now's the time. So we're going to monitor that closely and see what indications come from the local health departments, as well as the local elected officials, and we'll decide what role the state will play on helping that to happen. I've just mentioned we need to have better testing, more testing. Again, testing has always been an issue from the very beginning, and we've done very well at it in most instances. We've fallen off here lately, and we need to make sure that people are not inhibited to get their testing done for a variety of reasons. One would be cost. We're very concerned about what we hear out there with some saying, well, I'm not going to get a test because I know I'm sick, but I don't want to be on the records of being sick and causing some increasing, and for our young people, maybe they'll have a quarantine at their school, those kind of things. We're concerned about making sure we have honest, accurate data, and everybody has a responsibility to be a good citizen. So testing is something we're going to work on very diligently over the weekend to see what we can do to provide the opportunity for anybody who wants to have a test to get a test and not be inhibited to do so. That will help us not only find out who's got the virus, but it'll help us with our contact tracing efforts, which are going to be accelerated to see if we can, in fact, make sure we can isolate those who've got it and protect those who don't have it. So that's going to be at the forefront. Other measures by the government yet to be determined, but everything's on the table. Everything is on the table.
Hi, Governor. It's Ben Winslow with Fox 13. I did want to ask you, you've had counties that have said that they would like to presumably loosen their restriction levels, but are you considering further tightening those up, maybe sliding back to orange? And you have said in the past that if you saw a surge in cases, you might consider a statewide mask mandate. So is that back on the table?
All of those are on the table. They've never left the table. As we've explained before, with the plan we've put in place, which is still the most comprehensive plan of any state in America, the plan only works if we implement the policies of the plan, and that requires some individual responsibility on us as citizens of Utah to, in fact, comply with the recommendations. We hope people will do that because it's the right thing to do, not because there's some kind of government mandate. I think most of our people of Utah would fall into the category of doing the right thing for the right reasons to help themselves, their family, and their neighbors without being compelled to do so by some kind of government legislation.
But you've called for that before, Governor, and it's apparent now that the behavior isn't exactly following that right now.
Well, I was just going to expand upon that, Ben, and say, yes, we have been pleased with some of the actions that have been taking place, and we've certainly made some headway in most parts of the state. We have areas that are green now. They tend to be in more rural areas where social gathering and social distancing is kind of a norm, whereas in the more highly densely populated of the urbanized parts of the state, it's a little more difficult. I recognize those differences and we respect those differences. That's why we want local government people to make some of these decisions as far as what's the best policy for their community that they represent, along with certainly the local health department. But as we've mentioned, this is a dial. As we go through the different stages of restrictions from red, most restricted plan, to orange, modified restrictions, to yellow, less restrictions, to green, which is minimal restrictions, we have found it working as a dial. We dial it up, but we can also dial it down. And dialing down is on the table right now, and probably more at the forefront than we've had in the past. Again, I don't want to overreact, but I don't want to underreact. I'm going to look at the data. We're going to study this through the weekend, and we'll work with the local stakeholders, and then we'll make some decisions as far as what we should do, if anything, going forward. But mandating the masks, dialing back the color code on more restrictions from less restrictions, those are on the table for discussion.
Thank you. Governor, good afternoon. This is Chris Reed with St. George News. As far as the spike is concerned, we've obviously talked about Utah County. It has not been as much of a spike thus far in southern Utah and certainly in Washington County, not like it's been up there. How do you express any kind of urgency to people down here who may not be seeing this kind of spike at this point? We haven't seen today's numbers yet. Give a cautionary there.
Thank you. A good question. And again, we don't want to have people that are doing the right thing in the right way or having good success to, in fact, be punished because of other areas maybe where they're a little more lackadaisical right now. So we understand that concern. Washington County, though, you mentioned, has had about a 35% increase in infections this last week, which causes a little bit of pause. They're still in a good place. But we need to analyze that because, as I've mentioned, I don't want to go to green and have to roll it back to yellow a week later. Again, we have school in session at SUU in Cedar City and Dixie State University in St. George. We've seen what's happened in Utah County with 65,000 students coming back into schooling at BYU and at UVU. And so, as I said, there's kind of a red flag warning going on here now with this spike and the magnitude of the spike. It is the canary in the coal mine saying, wait a minute, be careful, be aware, there may be something happening here. So if we have to wait a week to make some decisions on southern Utah to go to green, if that's in fact what the data shows, that's probably well worth the wait. There's not going to be much loss economically, economic development, any other way that I can see if we wait a week to make that final determination. But right now, we're pushing the pause button in light of the magnitude of the spike we've seen this past week, and we'll make some decisions on that probably the first part of next week.
Yes, hi there, Governor. This is Courtney with the Salt Lake Tribune. I was curious, so the state released that guidance for schools that recommended that after 15 active cases, that a school shut down and go online for 2 weeks. We've had 2 schools here in the county that have decided not to take that recommendation. Do you have any thoughts on that? Would you have the state mandate that requirement instead of just recommending it?
Yeah, I'm going to have Dr. Dunn speak to that too, but let me just again mention the policy we have in place is not necessarily designed to be just forged in concrete without any kind of flexibility. You could have, 3 people in school that are all from the same family. Does that mean we quarantine the family or just quarantine the family, those individual students? And so the process allows for the stakeholders in a school district to get together and say, here's the data, here's what's happening, here's recommendations, but what should we actually do? And so there's flexibility given to local school districts, which I think they ought to, in fact, utilize and determine. It isn't a one-size-fits-all situation. There needs to be some flexibility. Dr. Dunn, would you like to speak to that?
So I don't have much to add to that. It is definitely a locally driven approach, and that's what we like to keep it as, because we know that the local school boards, when they work with their local health departments, they can come up with a really good solution that works for both parties. I will say, though, that we are seeing spikes in the community, we are also seeing spikes in the schools. So they are together. So in order for us to keep the schools open safely for the rest of the school year, again, we really need everybody out there to be wearing face coverings, practicing physical distancing, getting tested, and practicing quarantine and isolation if public health asks you to do so.
Let me just add, too, as we learn as we go, and trying to improve our policies as we go forward with new and better information. The good news is that the younger you are, probably the less serious the infection is, the less severe the reaction is to young people. Now, we don't know the long-term effects on heart and lung and those kinds of things, which should cause us all concern. Better safe than sorry, right? But even though they don't have this severe reaction, they tend to carry the virus and spread it to other folks. So even as we see this spike in 15 to 24-year-olds, mainly around our high school seniors and our college and university students, the concern is not just for their own lives, but for their ability to spread this to other parts of the community, back to their family, neighbors, the community at large. So it really is all of us working together. We're intertwined. The good book says the hand can't say to the foot, I have no need of thee, or the head to the leg, I have no need of thee. It's all of us working together to make the body function correctly. That's a good analogy for all of us. We all have roles to play. They may be different, but we have a responsibility to play those roles as best we can for the good of the whole and the health and welfare of the state of Utah.
Hello, Governor. This is Ryan Williams with the Provo Daily Herald. I wanted to ask you in particular about how you feel universities in Utah County, UVU, and especially BYU, have responded to the COVID-19 spread on their campuses. And also, speaking of that concern you mentioned earlier, what concern you see out of that younger population attending dances with no masks off campus and those kinds of events where masks are not mandatory?
Well, I have great regard for the leadership of Brigham Young University and Utah Valley University. They have great presidents and faculty there that I think are doing all that they can do in making policy a requirement to wear masks on campus, for example. I think at both universities now as part of their own protocol, their own decision-making process. So I think we're in communication with them. We'll have more communication over the next few days, but I think they're doing all that they can do, that they think is appropriate to do. The concern I have is with the students who aren't following the advice and the counsel and the policy that's been put in place by those two universities. In fact, some have actually had almost a defiant attitude about, well, you can't tell me what to do. And that's probably not the right attitude to have. Even if you disagree with some of the policy, I'm not sure that the inconvenience and the sacrifice we're asking of our students warrants the defiant attitude that some are displaying. Now, I believe that's the few, not the many. I think it's just an isolated few. But it gets the headlines in the press that you're putting out there. And we need to help them understand that, yes, you are young and invincible. That's the feeling. I remember being young and feeling invincible too. Now that I'm a little older, I don't feel as young and I don't feel as invincible. I know there's a natural tendency for them to want to get out and celebrate their youth and their vim and vigor at a prime time in their life as they're associating with people in school. We're just suggesting there's a better way to do it under the current pandemic that we have here in place. It's not business as usual. It's not school as usual. It's not socializing as usual. It's making modifications in your behavior to protect yourself and those around you and those you love. And recognize that in not doing so, you have unfortunately, the opportunity to spread the virus to others, which will impact not only their lives' health, but maybe your lives as getting a good education. We don't want our young people to have a disruption of their school and not have the ability to get as good an education as they're capable of receiving. But that takes a responsibility on the students' part also. So I appreciate the good work being done by both of those universities. We need to make sure that the effort from the students is commensurate with the efforts of the presidents of the universities and their faculty.
Oh, sorry. This is Sonia Hudson with KBR. I was struggling to unmute. I had a question for Governor Herbert. I mean, what would it take? You've talked about how important masks are. You've issued a statewide mask mandate in schools. What would it, and I know that a statewide mask mandate is still on the table. What would it take for you to get to that point where you would potentially issue a statewide mask mandate? What would it take for you to make that decision?
Well, I don't know that there's an actual number or a level of performance or non-performance that says, aha. It's one that we're probably going to look at a number of different metrics. It's not just the case numbers. It is, in fact, hospitalization rates. It is transmission rate. We're kind of at a 1-to-1, which is more of a stabilization, although that's bumped up just a bit here with this new spike, and that's not good. The number of ICU beds, and again, it doesn't translate the same across the state because some areas have more hospital beds than others. But what happens in Utah County impacts, for example, Salt Lake County. We might have people transmitted from Utah County to a special hospital, an ICU part of the hospital, to treat just COVID-19 patients. So what happens here impacts there. So it's really going to be a matter of us looking at all the data. That's why we had an emergency meeting today. We'll have more in the next coming days and then make some decisions on what the data informs us to do. That's yet to be determined, but certainly, as you've heard me say already, just a reminder, some of the more government aggressive approaches are on the table. And modifying color coding, mask mandates are things that will be discussed over the next few days.
Yes, Governor, this is Paul Nelson with KSL Radio. Sorry, I was also struggling to unmute. When it comes to the defiance that you've mentioned down in Utah County, why is it that, why do we believe that sometimes the defiance seems a little bit more pronounced there to wear a mask? And do you believe that government officials in parts of the state are caving maybe to pressure, political pressure to not make a mask mandate?
In a general way, I do believe that there are regional differences. We're not the same. The culture of Utah is in different parts of the state are different. Rural versus urban is easy for us to understand. And if you're in Wayne County where we don't have a lot of people, you know, social distancing is about 1 person per square mile. They don't have to worry about 6 feet much there. But if you're here in the heart of Salt Lake City, and the urbanized areas of the Wasatch Front, it's a different situation. So the cultures are a little bit different. The demographics are different. The politics are probably different. And those things all need to be taken into account. Again, I believe the best policy is the local officials making the decisions of the people they represent. I'm not a one-size-fits-all kind of a guy. And what we do in the northern part of the state may be different than what we do in the southern part of the state, and vice versa. I would like to take all the data we have and analyze it, digest it, and work with the stakeholders and say, okay, here's the plan going forward. This is what we believe we should do, and then let's all get behind it. And I would hope the citizens would get behind the leadership of their local elected officials, their health departments, and have a united and unified effort. We need to focus on this issue and unite our efforts to defeat it. And if we do that, we will. If we are divisive, if we can't come together, we're going to have a harder time, advancing the cause of stemming the tide of this pandemic. Last question.
Yes, we're here. Hi, Governor. It's Rudy Nieves with Telemundo, Utah. So my question is, so there's countless cases of coronavirus, and this has been since schools district start opening. My question is, do you think that it's good to have some modifications inside school to prevent the spikes?
So give me the question again.
So do you think it's worth it to make some modifications inside school to prevent the spikes?
Make modifications inside the school to prevent the spread of the coronavirus?
Correct.
Okay. Yes, I do. Again, all schools are not the same. And the scenario we see in Salt Lake City, for example, is moving to online schooling. And yet we're finding, for a variety of reasons, that not everybody is signing up for online schooling. Not all the students have signed up, and we don't exactly know why that is, whether they have capabilities, whether some are opting to move to other districts where they can have in-class education and schooling. So I do believe that, again, the local school boards, in conjunction with the superintendent and with the principals and the teachers in that school district, need to come together, as they have done in the past, to develop the plans and say, okay, this is what's happening. This is where we want to be, but this is where we are, and how do we, in fact, create a pathway forward to get to where we think we need to be and ought to be. So again, that's going to be an ever-evolving process. I don't think that so we set it and forget it. I think it's going to take everybody working together. As I've mentioned, it's a matter of us all coming together and uniting and focusing on this issue with a spirit of collaboration and cooperation, even though there may be some differences in some of the issues at hand. Let's not let the differences, which is our few, get in the way of the united efforts we have, which are the many, and be able to accomplish what we're trying to do in our local school districts. With that, we thank you all for your attendance today. Again, this is not a good news day, but it's not one that we say the sky is falling either. We are, as a state, in a good position. This is a matter of, hey, we've got a red flag warning. We take it seriously, and we're going to find a pathway forward that we can all unite and focus on so that we can, in fact, stem the tide of this pandemic and the spread of this Corona-19 virus, to make sure we protect people's lives, particularly those who are most vulnerable among us in our society, and also protect their livelihoods and make sure the economy continues to function. So far, we've done a good job of that. I don't want it to get away from us with this spike that's happened this past week. We are taking this very seriously, and we want you out there to take it seriously too. Thank you very much.
All right, that will conclude the briefing for today, September 17th. We thank Governor Herbert and Dr. Dunn, and we will talk to you again next week. Thank you.